Hi, my name is Dario. Today we're going to be doing trach sectioning. Whenever we're doing trach sectioning, we're going to check our orders that are placed by our physician. We're going to go ahead and check for the order, and it's there. Then we're going to gather all our supplies, which are here: sterile kit, drape. Okay, we're going to walk into the patient's room. We're going to introduce ourselves. We're going to explain the procedure. The patient's already had this procedure in the past. Can I have your name and date of birth? She provides me name and date of birth, which matches. Then we're going to wash our hands before we provide any type of care. We're going to put on the gloves, and we're going to get a full set of vitals, including pulse oximeter, stuff like that. Okay, now that we have everything ready, we're going to make sure we hyper oxygenate our patient because we're going to start the procedure. And now we're going to gather our suction equipment, which is our draping sheet here. We're going to get it all together on top of our patient. All right, and now with our sterile kit here, tell our patient that in order to raise her hand if she wants us to stop, the right hand if she wants us to stop, and the left hand if she has any questions. Okay, now that we've gathered all of our supplies, drape sheet is on top of the patient. We've already established commands here for if she has any complications. We're going to open up our sterile kit. We'll wash our hands, and then we're going to put on our gloves. We're going to pretend that we put on the gloves because they're too small for me. They don't fit. And then once we put on our sterile gloves, we're going to put on our other sterile drape sheet on top. Okay, and hands are still sterile. We're going to drop this there. We're going to put our normal saline in a basin. Okay, and then we're going to contaminate our left hand here by grabbing our equipment. And make sure that it's on. I'm going to turn it on. Okay, place it on normal saline, make sure it's running. And now we're going to connect it. Right, make sure we don't contaminate our right hand. Okay, alright, stay away from the thing. Let's check if it's on. And we're going to put on normal saline. Okay, alright, and now we're going to explain to the patient that we're about to start. We're going to remove the oxygen from the patient before we start, and now we're going to insert our tubing until we meet resistance. We're going to pull back 1 centimeter, and then we're going to assess pulse oximeter as we suctioning until we get all the secretions, and then we're going to pull back. We're going to assess the mouth of our patient after we've suctioned. She has no further secretions. We're going to put on our oxygen bag now at this time. And next, we're going to take the tubing off. We're going to cover it with our gloves. And we're going to get rid of this. We're going to throw it onto the sterile field with the gloves. Cover it up. Alright. And we're going to discard the biohazard waste appropriately. Then we're going to wash our hands, and we're going to assess our patient. Okay, how you doing, ma'am? She's doing fine. She has no further questions. We're now going to document that we provided the care, and that concludes the video.